All right, good evening. My name is Melissa Worthy with Class 104, Module 7, IV Administration. So today we're going to give two meds, one oral and one intramuscular. Um, Before we even give the meds, we're going to go over the MAR and to see who and what we're going to give. Um, Using the six rights. So the first is the patient. We have patient Millie Larson. Her date of birth is 1/1/1936. The doctor wants Docusate 100 milligrams, tab oral, and he also wants haloperidol 2 milligrams intramuscular. And the time for these doses are going to be right now. So we did the right drug, the right dose, and the right route, and the time is right now. So now I'm going to gather or go get these meds. So go to the medicine cabinet to get the med. The first med is the oral med, and the oral med is Docusate. Let's compare it with the MAR, 100 milligrams. All right, and it's in a tab. It's good. The expiration date on here is 10/23, so I'll put that on my cart. Got that. That's one that's verified. The second is the haloperidol, which is for 2 milligrams. All right, this right here is the haloperidol. The order calls for 2 milligrams. However, the vial is 5 milligrams per milliliter. The quick math that I do in my head, 2 divided by 5. So instead of giving the whole milliliter, we're going to give 0.4. So we're going to gather our supplies to give this. You're going to give a syringe. Either use a 1 cc or a 3 cc. I have a 3 cc syringe here. You're going to get a needle. You're going to need at least a 1 to 1.5 inch needle, which I do have, which is a 1.5 inch. This is the expiration is good, and it's a 22 gauge. All right, so I have my supplies to give the medication. I have the cup, I have alcohol. Okay, then we're gonna take the items to the patient's room to give the meds. So when we go in, I'm going to introduce myself. Good afternoon, Mrs. Larson. My name is Melissa Worthy. I'll be your nurse today. Your doctor ordered me to give you two medicines. One, Docusate, 200 milligrams, and it's for your stool softener, to soften your stools. The other medication is haloperidol, 2 milligrams intramuscular. I'm going to explain that a little bit later, but that's for, just to help you relax or agitation. Do you have any questions? She says no. But before I administer these medications to you, I just want to confirm your name and date of birth. Can you state your name for me? She states her name is Millie Larson. Your date of birth for me? She confirms her date of birth is 1/1/1936. Miss Larson, do you have any allergies? She says no. And that's what it says on the MAR. So now we're good for that. And she doesn't have any questions, so I'm going to continue to administer the meds. Before I administer the meds, make sure I sanitize my hands. All right, we already confirmed. May I take a look at your wristband just to confirm? I know you already said your name was Millie Larson, but may I just see? All right, her wristband confirms that she is Millie Larson, born 1/1/1936. Once again, I brought in the MAR, and I have my medications here just to make sure nothing happened. I'm going to confirm my meds again. So I'm going to confirm while I draw up. The first med I'm going to give is the oral medication. The oral medication, once again, is the Docusate, the stool softener. All right, it's 100 milligrams, and that's what it says right here. So I'm going to never wash your hands too many times. Sanitize my hands again. I'm going to open the medication. Sheesh. This one is sealed pretty good. Oh, there you go. It would help if I had my glasses on too, but I don't know where they are. So we're gonna put that in the container. I didn't touch the medication. Being careful not to touch the medication. Have water. I'll make sure that Mrs. Larson is in the proper position, which is the high Fowler's. I'm going to hand her the med with some water. I'm going to stay here until I know that she's taken it. And Mrs. Larson has taken her first med. I'm not going to document until both these meds are given. So the next med, you have any issues, Ms. Larson? She says no. All right, for your next med, we're going to administer is the, once again, according to the MAR, read it again, the haloperidol, 2 milligrams intramuscular. Confirm the med that's what I brought into the room. All right, before I go give it to you, can you do me a favor? I'm going to lower the head of her bed and put her on her sideline position. If you just lay lateral on your side for me, because it's going to be a medication that's going to give into your ventral gluteal muscle. All right, she says okay. She lay her down, put her on her side, and while she's sitting there, make sure that it's adequate lighting and she has privacy. I'm not going to unveil her until I'm ready to give the medication. Right now, I'm going to draw it up. Once again, sanitize my hands. Okay. I'm going to, I have the needles and the syringe. Right, going to attach. All right, I have once again haloperidol. Remember, I'm not going to use the full 1 ml because the order calls for 2 milligrams and it's only going to be 0.4. Going to pop the top, clean off top with alcohol pad, wipe. Let that dry for a little bit. Okay, I'm going to aspirate the amount that I want. Okay, not exactly a half, but 0.4. So I have the syringe. Okay. Open. Oops, excuse me. Right. Plunge down, flip over, and let that bring it down to the amount that I want. All right, I'm just going to do 0.5 and then I'll discard the rest. All right, make sure no air bubbles. Okay. Now I have the amount that I want, which is the 0.4. I'm going to don my gloves. Once again, clean my hands. Okay, Mrs. Larson, you comfortable? All right. What I'm going to do is going to give you, you're going to feel a pinch in your lateral hip area to locate the spot. She's sidelined with her legs straight. I'm with the palm of my hand. All right. I'm going to put it on the trochanter area, which is this area right about here with my palm. with the palm of my hand, I have fairly big hands, so the index finger is going to point to the superior iliac spine, which will be over here, and the middle finger is going to point to the iliac crest. And in between that area, the little triangle area that I'm talking about, which is the muscle mass, and within that area, that's where I'm going to give the injection site. All right. Now, obviously, we don't have a real patient, but I'm going to use the orange. With that, we're going to wipe from inner to outer, not making sure I don't go over the area only but once. Then I'm going to leave the alcohol pad marking the area that I'm going to. Obviously, we're using orange, so I can't use that. But what we're going to do, I still have this, which to label. And we said the medication is haloperidol, 2 milligrams. And we have tape to label it. We have a label maker. For the sake of the video, make sure we label it, because I forgot that part. I'm going to wash my hands and don some new gloves. So with the right position that I have already located, the right position, it still has the alcohol pad on there at a 90-degree angle. Right? I'm going to go down straight into the muscle mass area within that triangle. All right. Now for aspiration, we're going to insert, aspirate for 10 to 15 seconds. We shouldn't see any blood. And then stabilize with the opposite hand. Then bring down. And take out the needle. All right, put the safety cap on and put it in the sharps container. I'll get a 4x4, excuse me, a 2x2, block the area. With the 2x2, clean. Put it down, making sure she doesn't have pain, everything is okay. Then I'm going to put her in a proper position. Put the blankets back over Mrs. Larson. If she needs a band-aid, I would put one on, obviously, before I put the blanket back on. Put her in a position where she has the call bell within reach. Then I'm going to take off my gloves, wash my hands, and then I'm going to document on the MAR that I gave these two meds, given and the time. I document it and the time. I have asked Ms. Larson if she has any questions. If she do, she has the call bell within reach. Ask if she needs anything, and tell her I'm just a call bell away. And that concludes my medication administration. Thank you.